What is urinary incontinence? Urinary incontinence refers to a loss or leaking of urine due to faulty bladder control. An estimated 25% to 33% of people in the United States suffer from urinary incontinence. That means millions of people live with the condition. There are many different types of urinary incontinence. Although both men and women suffer from the condition, several factors unique to women increase the risk of urinary incontinence in females. It's a common misconception that this is a normal part of aging. It is not. Thankfully, there are lots of ways to manage urinary incontinence and minimize the effect it has on your life. Wide-ranging consequences. Urinary incontinence is more than a health concern. It affects people on a social, psychological, and emotional level. People who have urinary incontinence may avoid certain places or situations for fear of having an accident. Urinary incontinence can limit life, but it doesn't have to. The concern is treatable once the underlying cause is identified and addressed. Symptoms of stress incontinence. Common in women. Stress incontinence occurs when pelvic floor muscles weaken. The condition is the most common type of urinary incontinence in young women. Stress incontinence is the second most common type in older women. Activities like exercise, walking, stretching, bending, laughing, coughing, sneezing, or lifting place strain on weakened pelvic floor muscles, and that leads to leaks. Any activity that increases physical strain on pelvic floor muscles may lead to stress incontinence, even sex. The amount that leaks varies. It may be a few drops, or up to a tablespoon or more, depending on severity. Prevalence. Some studies suggest 24% to 45% of women over the age of 30 suffer from stress incontinence. If you suffer from urinary incontinence, you are definitely not alone. Weakness in not just the pelvic floor muscles, but also in the urethral sphincter often plays a role in this type of urinary incontinence. Causes of stress incontinence. Weak tissues led to leaks. Weakness of the pelvic floor muscles and tissues that support the bladder and urethra causes stress incontinence. These muscles and tissues may be weakened by a variety of things. Some of the factors that contribute to the disorder are modifiable, and some are not. Knowledge is power. Knowing the modifiable factors is the first step toward managing the condition. Causes of pelvic floor muscle weakness. Anything that damages, stretches, or weakens pelvic floor muscles may lead to stress incontinence. Some causes cannot be changed. Increasing age and female gender increase the risk. Pelvic floor surgery, injury to the nerves in the lower back, chronic coughing, smoking, obesity, and pregnancy and childbirth are also causes. Women who have multiple pregnancies are at an even greater risk, as are those who have undergone a C-section. Symptoms of urging continence: overwhelming urges. Urging continence occurs due to overactivity of the detrusor muscle. The hallmark symptom of this kind of urinary incontinence is a sudden, overwhelming urge to void, accompanied by loss of urine. Frequent urination and nighttime urination often occur with this type of urinary incontinence. The amount lost is variable. Hearing running water changing position may trigger bladder contractions and lead to urine loss. This type of incontinence can occur in anyone of any age, but it is more typical with advancing age. Just 9% of women between the ages of 40 and 44 suffer from urging incontinence, while 31% of women over the age of 75 suffer from the condition. Mixed incontinence. Sometimes stress incontinence and urge incontinence occur at the same time. This is called mixed incontinence. People who suffer from urge incontinence lose greater amounts of urine than those who suffer from stress incontinence. Those who suffer from stress incontinence notice leaks with activities that increase abdominal pressure. Keeping a voiding diary, noting the time, place, and activities associated with symptoms of urine loss can help the physician determine whether you suffer from stress incontinence, urge incontinence, mixed incontinence, or another issue. Causes of urge incontinence. The root of the problem. The causes of urge incontinence fall into two main categories. Irritation within the bladder is one potential underlying cause. The other is a loss of the nervous system's inhibitory control of bladder contractions. Neurological conditions like stroke, Parkinson's disease, multiple sclerosis, and damage to the spinal cord may injure nerves that control the bladder and lead to urge incontinence. Diabetes and cardiovascular conditions can also affect associated nerves. Alcohol consumption and diuretic medicine may underlie urge incontinence. Infections or inflammation that either irritated the bladder or damage its nerves may trigger symptoms. Something more serious? Urge incontinence may be a sign of something